And on our continuous focus on the pollution situation in the national capital, Mirror now spoke to 6 doctors who have confirmed that there has been at least 20 to 30% spike in respiratory illnesses this year. Cases of nasal problems and bronchial asthma have also gone up. While there has been a slight increase in fresh cases, existing cases with infections have also aggravated. Meanwhile, Delhiites receive no respite from the air pollution as the quality of the air continues to be in the very poor category. Amita Balachandra joining us from New Delhi. Amita, I can see you're wearing a mask, something that I've never seen you in Mumbai at least. But the fact of the matter is, are people finding ways and means to work their lives around the air pollution situation now? Give us a sense of what the doctors that you spoke to tell us.
Not really, Frida. We've been talking to a lot of parents who have been telling us that they prefer to keep their children at home. They prefer to stay indoors. Considering the air quality here in not just in Delhi but also in Gurugram and Noida go up from very poor category. In fact, in Noida, it is severe as of today, above 400. Means that in fact power plants etc. has to be shut down according to the graded action response system. Apart from that, we saw emergency being implemented by the environment minister. However, on ground we don't see much of that as yet. Now, as far as parents are concerned, they say they're keeping their children indoors, considering respiratory illnesses have completely gone up. It's gone up by 20 to 25%, and it's worse, doctors say, when compared to last year this season.
Right. So there is a huge spike in the number of cases when it comes to respiratory illness. Now, what is the solution? Because, it seems that there seems to be no sense of urgency when it comes to the government. Is the Delhi government aware of the severity of the situation, at least in terms of the health hazard that the pollution is causing the citizens of Delhi?
Well, it doesn't seem like it at this point, Frida, because if you see the forecast as well, over the next couple of days, the category of air is going to remain very poor according to the center-run system suffer. It says that it's going to hover in the 350 category itself. Now, as far as doctors are concerned, they say that the number of patients, of course, have gone up. But in terms of ensuring that the infections don't go up even further, they're asking most people to now stay indoors. We also see a lot of people, considering it's also New Year's in a couple of days, not in the city at this point in time. As far as mothers are concerned, they're extremely scared for their children because the doctors have pointed out that children are the most vulnerable of the lot, and their percentage increase has significantly gone up.
Right. Amita, thanks for joining us. In fact, let's listen in to what the doctors have to say. I believe you spoke to quite a few of them in the national capital. Let's listen in to them.
There are all sorts of problems. The most common is the cough is not responding to the usual treatment for patients who are really not patients, who are normal people. Then there is a worsening of symptoms of patients of bronchial asthma, chronic obstructive lung disease, and other respiratory illnesses. So those patients are getting infections. There is an exacerbation. That means there is more breathlessness in these patients. So this is the group of patients which are the most common. In winters, these patients are more, but I think this year definitely there is increase in number of patients as compared to last few years.
It's basically inflammation of the tissues in the nose, and they're presenting with these kind of symptoms. And most of them actually, have a history of like 3 weeks, sneezing and rhinorrhea, or at the most 1.5 months. But no chronic illnesses. I mean, chronic illnesses otherwise we're getting, but this sudden outpour of patients is all about recent illnesses and recent allergies.
So then would you say that there's a 20% increase at least?
Yeah, 30% I would say. Yeah, 30% rise in the outpatient, footfalls, and all because of the allergies.